Dr. Monarez,
Yeah.
Dr. Howry, I want to thank you for being public health heroes. When you took your positions, you swore an oath to public health and safety, not to political ideology. And you kept that promise to the American people. When confronted with pressure to make decisions based on political science, you chose real science. You said clearly that vaccines work, that they are safe, and that our children and most vulnerable deserve the life-saving protections that vaccines have provided for generations. Robert F. Kennedy Jr. may put the con in conscience, but you put the science in conscience, which is where it belongs at the CDC. It is my hope that more officials within the CDC, within HHS, and throughout this administration look to what you, Dr. Monarez, and Dr. Howry have done, and that they feel inspired by what you have done and what you're doing here today. In the face of political pressure and threats and misinformation and conspiracy theories, you are standing up for science, standing up for facts, standing up for the protections which our children and families need. You're standing up for what is right, and I hope that your colleagues follow you. Before hepatitis B vaccine was approved in the 1980s, upwards of 300,000 Americans were infected each year, including nearly 20,000 children. Thanks to hepatitis B vaccine, annual cases are now down to roughly 22,000, a 93% reduction. And for children, there is now only a handful of cases each year, with a total of only 13 cases in babies in 2022, down from 20,000. That is a stunning public health success. We achieved that because every newborn gets the Hep B shot at birth. Why? Because 9 out of 10 infants infected at birth become chronically infected, and a quarter of them will die due to hepatitis B. Yet this week, the Advisory Committee on Immunization Practices, a panel newly filled with Secretary Robert F. Kennedy Jr.'s handpicked vaccine skeptics and individuals with no vaccine or public health expertise, is expected to vote on delaying that birth dose of hepatitis B vaccine until age 4. This would reverse decades of progress, put kids in harm's way, and make countless children the victims of Secretary Kennedy's anti-vaccine quackery. Dr. Howry, do you believe that a change to that recommendation on hepatitis B vaccine at the advisory committee meeting this week would be based on an objective, comprehensive review of data?
So if the vote is to change it to age 4, then that would not be based on data.
Yeah. Do you agree with that, Dr. Monarez?
I haven't seen any evidence to suggest that that would be the appropriate thing to do.
So, yeah, so based on your interactions with Secretary Kennedy and his advisors, are Secretary Kennedy's beliefs in politics driving the change to vaccine recommendations, including hepatitis B vaccines, instead of science and children's health?
That is the concern.
Dr. Howry.
Yes, I believe it is. I received an email, suggesting that we look at hepatitis B, shared decision-making. And I think that's where I'm thankful to Senator Cassidy for really raising hepatitis B via social media. I hope that this hearing makes ACIP reconsider this recommendation.
Yeah. Would you want them to reconsider the decision, Dr.?
I would want them to keep it at birth. I think there's a lot of moms that don't know they have hepatitis that can then transmit it to their baby. And even if the mom is hepatitis B negative, we don't know what the home situation is.
Dr. Monarez, were you or your team asked to provide any data regarding hepatitis B and the vaccine in preparation for the upcoming ACIP meeting?
So I am not aware of any requests to myself. I would defer to Dr. Howry as well, as she was overseeing.
But we directed our staff to provide data because we thought it was important, just like we have in other meetings to where there weren't work groups, that CDC staff provide data to discussions.
Is that traditional practice where
No,
people are not, where experts are not being asked?
Well, traditionally there's work groups that develop it, but we had a case at the last meeting to where our experts developed evidence because there wasn't a work group, and we were asked by the Secretary's office to remove that document.
Yeah, Dr. Howry, is the current Hep B vaccine recommendation a universal birth dose for infants based on a thorough and comprehensive review of decades of data and evidence.
It has been, and I think if we reconsider recommendations, we just need to look at the updated evidence and always weigh the risks and benefits, and that's what the committee should do.
Is that evidence that you have seen conclusive to change a decades-long recommendation?
So I haven't seen any of the updated evidence. They were working on that before I left.
Yeah, well, you know, the concern, of course, is that Robert F. Kennedy is going to make America sicker again. They're going to send us towards more disease, more death, and more despair in our nation. And again, I can't thank both of you. You're healthcare heroes, historic healthcare heroes for our nation. Thank you.